Morning, everyone. My name is Abhishek, and on behalf of National Foundation EMDA Southasia and All Indian Institute of Local Self-Government, I welcome you all to this special webinar on disaster risk mitigation and sustainable communities. Globally, the impacts of disaster have risen rapidly over recent decades, affecting almost all sectors. Rich countries, poor countries, almost every country is affected one way or the other by disasters. Several hundred million people are affected annually, and losses of this disaster reached a record of US $371 billion in 2011. That is a old data. The figure may underreport the true losses by 50% or more. It does not incorporate knock-on impacts across economies, and it undervalues the relative economic impacts on individuals and particularly poor households. So today we are discussing this topic. This is very important topic because our Prime Minister Narendra Modi has also talked about the mitigation of disaster and reducing the negative impact of disaster in his 10-point agenda during the 7th Asian Ministerial Conference that was after Sendai Framework in November 2016. So it has become very important, especially in this time of pandemic when we are facing economic losses, job cuts, businesses have been shut down, and because of disaster. Urban local bodies in India and worldwide, they are suffering great impact of this disaster. We have seen that even in India, that migrant laborers and the people from the disadvantaged groups, they have suffered most. Today, we are going to discuss this topic of disaster mitigation and sustainable communities. We want to ensure that all the urban local bodies, all the stakeholders are empowered so that if any such thing happens, so they are able to respond well, they are prepared well, so the negative impacts of such kind of disaster can be reduced. I will not take much of your time because we have an illustrious panel, eminent panel of speakers today who have in-depth understanding and knowledge of how this disaster risk mitigation works and how we can empower our urban local bodies and other stakeholders to reduce the negative impacts of disaster. So I am today we are joined by Professor Santosh Kumar. He is a renowned disaster risk reduction, policy planning, and capacity development expert with more than 25 years of experience. A PhD in economics, he studied gender and development in IDS Sussex, United Kingdom, and received professional training in disaster risk management from Israel, backed with international work exposure at the World Bank and intergovernmental body of SARC. He has also worked at state levels in different capacities in UP Academy of Administration, Nainital, and RIPA Jaipur. His specialization lies in disaster management, planning, post-disaster loss and need assessment, recovery, and inclusive disaster reduction. So I will invite Professor Santosh Kumar to give us the basic understanding of this, the importance of this subject with his introductory remarks on this in this webinar. Over to you, Professor Santosh Kumar.
Thank you. Very good morning to everyone. Thank you, Abhishek. I welcome, first of all, I extend my heartfelt welcome to Professor Vinod Menon, Mihir Bhai, and we have Dr. Asarya, if I'm pronouncing his name correctly, and we have Mr. Gagan Sinha and Abhishek. We have our team members, Dr. Anuradha and also Ms. Mohanna. All are there and they are attending, and all the distinguished participants who have joined in Facebook and also directly joining this webinar. National Institute of Disaster Management is a body of the Government of India, has collaborated with the All India Institute of Local Self-Government, with EMDA and other partners with them and Urban Update, especially to look into and to reach out what Honorable Prime Minister is saying, that building local capacity. And the role of local government is very, very important when it comes to the disaster risk reduction. And when we see, and most of the time when we have been, as you said, that 25 years in this sector, many more have spent their entire life in this sector in terms of making risk reduction. And we are also trying to we are struggling to get some pragmatic answer where we can actually execute at the field. And even in the Sendai framework, which everybody is talking about who are working in disaster risk management area, the Sendai framework came in 2015, along with the SDG also for 1530 and also COP21 1530 kind of agenda. So I say that even if you don't do the disaster management, forget about Sendai framework. But if you do remember the SDG, Sustainable Development Goal, and COP21, then probably, and if you say that whatever the investment you are making in that area and how the dividend of development can be obtained. And we are finding, as you gave the number or the figures, that how many money which we are losing along with the lives. So this is a clear kind of an indicator that we have not been able to make a good investment in terms of the dividend should continue. Also in 2015 alone, 92 billion US dollar got off the development sector. So if these kind of losses are occurring on a regular basis, then probably sustainable development goal is a pipe stream in terms of that large number of this damage to infrastructure, and these things are happening. So in this kind of a scenario, and when we wish to go for ex-ante disaster risk reduction, then probably the role of the local government is much more pronounced than that central government and the state government. Could be that we need to have a reverse pyramid approach where the center should not be very thick and big kind of investment planning. It should, all the activity should happen at the local level, where the exposure of risk is very, very high. So how we are thinking in terms of taking and strengthening, whether local government is able to do the needful, and what are the capacity which we do the analysis all India basis, then we find that which are the local government is really equipped with taking all the DRR agenda along with the SDG and other. I was reading the other day report that Government of India alone is planning to make also in 40 years or by 2050, $30 trillion in investment in the urban area, urban infrastructure. So when I see and look at the infrastructure today and the capacity of the cities, and if you just inject $30 trillion in infrastructure again into the cities, and how these cities are going to sustain itself, whether those kind of a land available in terms of the safer land where the people were. Why I'm talking this about seeing the example of Kerala and take the density of urban population if go by saying 2050, where the land scarcity, and also see the where they would be settling down. So largely if you see in Kerala, 2018 flood and 2019 flood largely affected the urban area. And the good part was that urban governance also helped in terms of recovering from this disaster. So because maybe that they control more than 50 to 60% of the state budget, development budget. And so they have the good capacity where we can emulate from Kerala and Maharashtra and Karnataka, that what kind of a scenario they have. But in the other states where the high exposure to risk, say Bihar, Assam, Orissa, then you talk about all this east coast of the states, Andhra, and so on and so forth. There the exposure of risk one and after another, this disaster is happening. And especially at the time of COVID-19, we had just phase 2 or 3 cyclone, and the one is also in the offering. So kind of one is likely to pass tomorrow or day after, kind of in Kerala and Tamil Nadu and Sri Lanka. So the challenge is there. So how our local government can get together with the agencies who are working on disaster risk management, how that capacity flow should be there from national to the state and to the local government, so that local government is in a position to decide about this investment, what is going to, and to be, and what kind of this capacity they need at the local level. Because this COVID-19 has exposed our kind of weaknesses. And that is where we can learn from this. That recently we had conducted one workshop with the UNSCAP, and we found that large number of cascading impact which is occurring, and public health and the disaster risk management should not be separated out. So in this context also, we need to look at that how public health issues and the disaster risk management can go down to the local level understanding. So that is the few challenges which I wanted to find out, that where they are today, how and what are the capacity need they have, and third, where and how, which are the agencies which can help them to actually strengthen their capacity. Everybody is talking about now the 15th Finance Commission report, which has allocated almost 6,000 crores, almost 6,000 crores, 5 years term. If you calculate, they might be a little lesser or higher for the capacity development alone. So how that will go as a kind of a chunk will in the capacity development. Secondly, also that Finance Commission talks about this risk mitigation fund, and that fund will also at the local level, that will the local level project should be taken, and that should be strengthened for risk mitigation. So these two things are there, like what I'm saying in terms of that recent governance intervention, which is a kind of, we say that as a landmark in DRR. There's a watershed which we are going to say that struggling for last so many years to have a mitigation fund and how that mitigation fund get transferred to the states and that to the local government. So this is an opportune time that we can think of that what are the lessons we have drawn from COVID-19, and also that cascading impact during the COVID-19 also we had to respond to different disasters and also work for mitigation. And day-to-day governance, what we the SDG agenda and the COP21 that's going parallelly. So in this context, how we draft a framework which could be useful, and we have two, three stalwarts here sitting in this panel, and probably they will guide an NIDM that how we can move from here. So together with our partners, Urban Update and EMDA and All India Local Self-Government, how we can think of taking this. Just doing a one webinar probably will not be answer to the largest problem which we have today. The idea is to how we are actually capitalizing our partnership in this area. So building synergy, building partnership, all sector approach, how we can move on. And we say that if we don't do that, the capacity, I would stop here. I will not take much time. I would like to definitely intervene in between if some certain important point comes in, and Abhishek said that we can have intervention if you have any question. Also, later part of the, when all the panelists are through, I know that a lot of wisdom are going to come on this floor, and probably we would relish those also as and also challenges for the future. So thank you very much, Abhishek, and my entire team, Dr. Anuradha and Mohanna, for having this coordinated with EMDA, and I'm grateful to all the resource persons, those who have joined, Professor Menon, Gagan and Abhishek, and Dr. Saab, who is there, and already Mehir Bhatt. And so thank you very much once again.
Thank you so much, sir, for highlighting the issue of that this urban population is also increasing and the risk of disaster is also increasing. I think this is the right kind of partnership All India Institute of Local Self-Government and NIDM has, because both are working in their respective sectors, and this partnership will definitely bring good results on ground. Thank you so much for your insight on this subject and why this is so important for all of us right now. Thank you so much, Professor. And now I would like to move to Professor Vinod Menon for his special address on this subject to tell us more about how we can develop, create sustainable communities and reduce the risk of disaster and create a framework for disaster mitigation. Professor Menon, I will introduce Professor Menon. He's an alumnus of Kerala University and Jawaharlal Nehru University, New Delhi. He has 34 years of working experience in training senior administrators, conducting research studies, and has specialized in disaster management, climate change adaptation, and public policy analysis. He is now acting as senior professor and head of the School of Compassion, Peace, Humanitarian Action, and Disaster Risk Management at MIT World Peace University, Pune. In 2005, Professor Menon was nominated by Dr. Manmohan Singh as a founder member in the National Disaster Management Authority, Government of India, with the status of a Union Minister of State in the Government of India from September 2005 to September 2010. He has been a consultant to UNDP, UNESCAP, UNICEF, ADB, World Bank, GFDRR, Economist Intelligence Unit, international NGOs, national NGOs, state governments. So I think with his such a vast and rich experience in the field, I would request Professor Menon to please give your insight on this subject. Professor Menon, over to you.
Thank you, Mr. Abhishek Pandey, Professor Santosh Kumar, Mr. Gagan Sinha, and Dr. Dikshit, and Mihir Bhai, and all other distinguished colleagues, friends. Very happy to be here to share some thoughts on disaster risk mitigation and sustainable communities. And I'm sure that all of us who are actually seeing the world going through a crisis, 217 countries have been impacted by the COVID-19. And we have been seeing these numbers actually, rising every day. In fact, actually, if you really look at the numbers from what it was yesterday and what is it today and what is it actually happening right now, these numbers are changing so dynamically. In fact, if you look at any of the websites which have been really tracking population growth, and this is actually almost similar. The COVID-19 caseload transmission, which is happening now, is almost like the population explosion, which is happening. Every second, we are actually finding new infected cases getting reported in different parts of the world. Now, in this kind of a situation, how do we really look at resilience building of communities, resilience building of nations, which was talked about in 2005 when the Hyogo framework for action was actually discussed. And that was also signed by more than 168 countries. And for 10 years, 2005 to 2015, there was supposed to be a work to build the resilience of nations and communities to face disasters, to withstand disasters. And so that 2005 to 2015 10-year period is over, and now we are going through the decade of 2015 to 2030, 15 years, actually with 4 major frameworks. One is the Sustainable Development Goals with 17 goals, which all of you are familiar with. The other is this Sendai Framework for Disaster Risk Reduction, SFDRR, again from 2015 to 2030. And then we have the COP21, the Paris Agreement on Climate Change, 2015 to 2030. And then we have the new urban agenda because of the increasing urbanization which is happening. We have 26 mega cities with more than 10 million people, which is expected to be the urban population, 26 mega cities by 2025. Out of them, we have actually 4 of them. We have Delhi, Mumbai, Calcutta, and Chennai. 4 mega cities coming up in this list of 26 mega cities in the world. And now, if you really look at these mega cities and the population growth which has been happening, we also see that COVID has actually hit us very, very, devastating impact has actually happened. Now, we look at how the disasters have affected communities. All of us have seen the impact of COVID-19 when the lockdown was announced on the 24th of March, and we had 5 lockdowns, 5 versions of the lockdowns, from lockdown 1.0 to lockdown 5.0, 5 versions, and we saw the migrant workers traveling, leaving for their homes on foot, on cycles, on vehicles, whatever vehicles they could find, they were all on the roads. And we saw that happening for several weeks on end. And we really do not have the numbers of the people who actually left. Because if you really look at the numbers in the census 2011, the number of migrant workers in the country, these numbers actually are very astounding. In fact, if you really look at the total number of people who have been impacted by this COVID-19 in the country and all over the world, more than 150 million people have been pushed into poverty and deprivation, into malnutrition, into hunger. This is something where, we need to really understand that, the 2015 to 2030, 15 years time frame is, we really don't have the luxury of, really catching up with the lost development gains. We have lost seriously development gains, which we have actually tried to achieve in the Millennium Development Goals and also in the first 5 years of the Sustainable Development Goals. And we have really lost that now. And for that, that's the reason why agencies like EMDA, or, when you're discussing urban, urban debates and also urban updates, and, the urbanization issue is actually a challenge. And then we know that, in the urban areas, in the slums, we need a different risk communication. We have seen that, the online education has not been really a luxury which, people could afford. We have had shortages of laptops, of smartphones, and internet access, data access, and so on. There were many constraints. So you have seen actually on the schools in Jharkhand, we have seen that on the walls, black paint has been put. Blackboards were created on the walls, and children were sitting with physical distancing, and then using those, improvised blackboards on the walls. And our poverty and our, lack of access to resources is actually something which we need to address. And that is where resilient communities have to really come up. And if you really look at what has happened, many of you may have read these 3 reports from the Stranded Workers Action Network, SWAN. They have published 3 reports on the problems and the plight of the migrant workers. There is a network called Coast India, which is the COVID Action Support Team, a network of alumni from prestigious national institutions like the Asim Premji University, National Law School University, Ashoka University, and many others. So we have been actually seeing that, if the civil society network was not actually actively involving in support, extending support to the migrant workers, we would have actually had a very serious crisis in terms of, the lack of food, lack of, jobs, lack of funds for travel, and so on. So I think, this is a time when we actually really need to understand that I was actually in a conference, in a webinar series with friends from China and friends from, from Italy and from the United States. And they were mentioning that politics and economics has actually really taken over public health, and issues of, addressing social inequality. Politics and economics is really driving us now. And so how do we really, ensure that we empower communities? And that is a challenge before us. So I think that, we need to look at who are the vulnerable sections. The vulnerable sections are the informal, unorganized sector people. The vulnerable sections are the palliative care patients in the hospitals. They are the excluded sections, the scheduled castes, scheduled tribes, Dalits, OBCs, and minorities. They are the transgender. They are the people with disabilities. Today is the International Day for Disability. We observed that, International Day for the Disabled People. And differently able people have also been deprived of many of these, issues. And in fact, if you really look at the numbers, in the United States, 5,500 hospitals in the US are attending to, 360 million people. And the United States, the CDC, the Center for Disease Control and Prevention, reported that 100 million people may have been infected with COVID-19 in the US out of 360 million people. That is 1 out of every 3rd American could possibly be under COVID-19 impact. And in India, ICMR came up with a report which said that by August, the serosurveillance studies which were conducted showed that 74 million people were infected in India. And so whatever we are talking about, 94 lakhs of people infected is only the tip of the iceberg. We are having this transmission happening. People are recovering, the antibodies are getting, developed, and then, we are actually seeing people recovering themselves. But at the same time, many people are also getting infected. We are losing lives, unfortunately. In terms of the number of people who have lost their lives, this is very tragic that, we are losing lives and very valuable lives. 1,400 doctors have died in the US. And in India, the numbers are probably 800 or more, in terms of what the reports have come from the Indian Medical Association. So saving lives is important. Preparing ourselves is important, because I think COVID-19 has given us some kind of an early warning. And we have actually had 10 months preparedness, but we need to be prepared for effective vaccine administration. We need to really understand, because even the problems in terms of getting the PPEs and N95 masks, and also the testing kits, we know what we really went through. We are not really prepared to face a calamity of this devastating nature. And our health facilities at the rural areas are not equipped to face something of this nature, which is actually happening. And we know that from whether it is the Japanese encephalitis, or whether it is the acute encephalitis disorders or whatever, we know that we are not really equipped to face something where millions of people are actually impacted. We really need to strengthen our capacities. And I would also like to mention that our people in our institutions, whether it is old age homes, orphanages, or working women's hostels, or prisons, or juvenile delinquent correction homes, we need to know that all these people in these institutions are all vulnerable, and they are actually extremely vulnerable to a possible spread. Just one person getting infected would actually help to spread this across people. And so we need to really have the capacity to strengthen ourselves, and that is some of the challenges which we have. We were discussing also about the need to look at our own capacities to improve our own responses. And I think how do we really build resilience? And that I would say that we have people like Mehir Bhai, who has been working on this in terms of creating capacities, not only in India, but also in different countries around the world, where, along with AILNAP and various other institutional networks, along with UNISDR and the UNDRR now, UNOCHA and others, we have actually been seeing how capacities can be strengthened. So I would like to just mention that crowdsourcing is important. Working with partnerships is important, and partnerships probably is the most important Sustainable Development Goal, SDG. Out of the 17 goals, I would consider partnerships to be extremely important. And I hope that we will actually be able to see more and more of collaborations coming together of organizations and institutions working and look at the policies, strengthen the policies, work together, and look at international collaboration. That is also needed, because we would need to understand how some of the good practices from other countries, how we will be able to see that. And I'm originally from Kerala, and so we have been monitoring the Kerala episodes, how Kerala controlled this during the first few weeks, and how the first wave was actually contained very effectively by Kerala through testing, treating, tracking, and tracing. 4 T's: testing, treating, tracking, and tracing. We use the IT-enabled solutions by looking at the web-enabled and mobile phone-enabled geofencing of people who are positive, and then looking at their primary contacts and secondary contacts, and then containing the spread in the initial days. And now, after the Vande Bharat mission flights started bringing in Keralites from the Middle East, it went out of control, because more than 7 lakh people came back. 700,000 people coming back is actually something which we had to take the shock of that. And so containment was not easy. And that's why we are seeing the Kerala now coming up, the cases coming up. But I would request everybody that resilience building is something where all of us need to work together, and crowdsourced sharing of data is important. Analysis of data is important, because we have tools now. We have AI algorithms, we have machine learning, we have big data analytics. And I'm sure that all those people, the friends from EMDA, whether it is Netherlands, Luxembourg, or all your colleagues and partners in the EU, they have been seeing a lot of development of IT-enabled solutions. And I wish everybody the very best coming days with the onset of winter, with the wedding season, with Christmas and New Year. There's likelihood to be major surges and spikes happening. Please be safe. Thank you very much for this opportunity.
Thank you so much, sir. Thank you so much for your speech on this subject, your address on this subject, and talking about technology and partnership. That is very important. When we're talking about partnership, I would like to mention that EMDA South Asia, Foundation EMDA South Asia, who is working with All India Institute of Local Self-Government on many fronts, has been instrumental in bringing this partnership with NIDM and All India Institute of Local Self-Government for this important series of webinars that we are doing. I would like to, before I move to other speakers, I would ask Mr. Gagan Sinha to please tell us something about the partnership that EMDA South Asia is planning to do in this domain of disaster, and what is his vision of organizing this webinar and series, and then we will move to other speakers. Mr. Gagan Sinha, I will just introduce him. He is Secretary General, Foundation EMDA South Asia. He is actively involved in the development sector for last 2 decades for project consultancy, development assistant, and fundraising, international development cooperation, cultural, social, and academic programs, promotion of policies and schemes. So, Mr. Sinha, I would request you to tell us about this, like Professor Menon mentioned about the importance of partnerships, and what is your vision of this partnership and how you see it,
yeah.
Mr. Sinha.
Thank you, Abhishek. First of all, it's a privilege to be on the same panel as such eminent speakers as Professor Menon, Professor Santosh Kumar, Mihir Bhai, and Dr. Dixit. And of course, in a small way, EMDA has been working in the disaster relief and mitigation for some time now. And it all started from our main office in which is based out of Luxembourg. We are handling the South Asia region, primarily India, and we get to we have a lot of knowledge sharing between what's happening in other parts of the world and what we can adopt here, and with such such as Mr. Santosh Kumar has also been a guiding force for EMDA for a long time in how to work out strategies as to implementation. So we have also, other than just with ideas, we have been pretty active on ground by way of also trying to see where we can link up certain actions to funds availability, which is also a very critical part, be it from Indian donors or from international partners. We also help with the technologies, or such as Professor Menon mentioned, be it IT or even for new products that can be implemented. Primarily now, as we see, it's not just so this pandemic which has just come in is also such a new concept for, I would say, everybody in our generation that's living. So earlier we were looking at earthquakes, floods, forest fires, but this kind of unseen, or I say invisible enemy, or something that is creating a disaster is a very critical point. And needless to say that no one is prepared for it. Even the most advanced countries are not prepared for it. So in our suggestion here, one could be that one has to be ready and prevention is always better than the cure, I would say. So that is something which EMDA would like to focus on with partners such as All India Institute of Local Self-Governance, which has been very, very active in the urban space, and we are also trying to see how we can move into the rural areas, so we can build in a scheme to not only, for example, there is enough training for finance, for economics, for wastage, but we need to have a strong component for the prevention of any unforeseen disaster, as you say, or any kind of problems that can arise. So that is something we're trying to now put our minds to, and we would welcome certain ideas, especially from this this webinar that we are having. And of course, we'll welcome any inputs that we get in the future. So with that, I'll hand over to Abhishek again. Thank you so much, Abhishek.
Thank you, Mr. Sinha, for telling us what you are doing and how you are helping this whole ecosystem of partnerships and making efforts to build resilience and also building capacity at local level. Thank you, Mr. Sinha. And now, before I move to Mr. Mihir Bhatt, I would like to tell all our attendees, because those are watching us on live on Facebook and also on Zoom platform, they can post their question in Q&A section of on Facebook. They can comment, and on Zoom platform they can post in Q&A section, and then I will direct those questions to the respective speakers and panelists. So now I will move to Mr. Mihir Bhatt. He's the director of All India Disaster Mitigation Institute, but is currently engaged in evaluating and humanitarian work of both United Nations and international non-governmental agencies on tsunami relief and rehabilitation activities in coastal areas of South India, Sri Lanka and Indonesia. Among his many achievements, Bhatt received the Russell E. Train Institutional Fellowship from the World Wildlife Fund in 1997 for building an action-focused research institution focused on risk reduction in the global South, and an Ashoka International Fellowship in 2004 for his innovative approach to using social enterprise for long-term recovery of disaster victims. So, Mr. Mihir Bhatt, sir, I would like to invite you for your presentation, your speech. Over to you, sir.
Thank you. Thank you so much, Dr. Pandey. And it's always a pleasure to work with All India Institute for Local Self-Government, both here in my city, Ahmedabad, where it is very active and effective, but also on the climate-related issues we worked in the past through CDK and at a South Asia regional level. And there is a tremendous localization agenda that Dr. Pandey, your institution, is doing. So I'm very glad you picked up this particular piece of work, and also that you are seeing that move further. So that's old friends. Also, EMDA is a great pleasure to work with since Gujarat earthquake, actually. And we've continued our collaboration and exchange of ideas, plans, a lot of work together. So it's good again to catch up on this existing initiative and the future initiative in the rural areas that EMDA is planning. And that would be very, very useful addition to the Prime Minister's program, which needs far more both local and rural outreach than it has so far, in my humble opinion, achieved. And of course, Dr. Santosh Kumar, we've been almost, if not daily, at least weekly, taking up some issue or the other. There is so much happening in the field that running out of steam and enough time. Last night, it was 3 o'clock in the morning. One was trying to finish things because, this pandemic has really put pressure on all of us. And I texted somebody at the time, and that person was also working. So it's not that just some of us are working. I think everybody in the sector is very busy working on this. So that brings me to Dr. Menon, who is so active 12:30, 1:30 till 2 o'clock, promoting volunteer work that is needed so much in our country, because in the end, it's the implementation which matters. And that's something he's taken to his heart personally and, of course, professionally to do that. I have been also benefited a lot from the work that Practical Action is doing, both at a regional level. Dikshit Saab, what Achyut Bhai is doing, but also in terms of the work that is being done in India Orissa and elsewhere. So that's something again builds up. So it seems to me almost like a small little team meeting of collaborators and partners. And that's, I think, a very good feeling to have, not only for us or us here on the panel, but I would open that to also people who are participating, all of whom we can't see. But this collaborative effort and feeling that we are all part of the work in same direction is very important. And that direction is disaster risk, mitigation, and sustainable communities, which is what is picked up. And what I'm going to focus on, Dr. Santosh Kumar, as we were also thinking for quite some time, is to look at that what are the opportunities to move ahead. Because we do need to do a lot, and we can spend time doing things which perhaps we've done and do more of it, or be a bit more strategic and do things which needs to be done, which will take us not one or two, but several steps ahead. So that's what I'm going to look at, a view on opportunities in terms of disaster risk mitigation and sustainable communities. And of course, within that, I would look at from the point of view of local, urban and rural local governance. And not only because the All India Institute is focusing on that, but also that's an area where the whole localization agenda needs to actually happen. And if at all, there is one thing which is very common to the success for Kerala, which is recent, but in the past, if you see some success that Assam or Bihar or many other states have achieved, including Gujarat, and that is the localization of agenda. When things have happened locally, things have happened better and faster and cheaper as well. So that's what I'm going to focus on. And what I will do is, obviously, Dr. Pandey, you said, and Menon Sab, you also mentioned that not separate disaster risk from the that is there in Prime Minister's agenda, and which is there in SFDRR, Sendai Framework, but also see disaster risk from the point of view of SDGs. So we'll go a bit beyond disasters traditionally looked at, and Paris Agreement. And that's very important, as we will soon know, because the climate change is causing major new hazards and risks, and we are already facing some of that. The series of cyclones is one example where which was predicted by SREX report, and now it is actually happening. One feels a bit guilty of having predicted that. But also what I'm presenting is a forward-looking, that how do we go ahead and what do we do? But I'm doing that fully recognizing the excellent work that various state authorities have done in Kerala and Bihar and Assam, recognizing the very committed work that institutions are doing, educational institutions such as Ashoka and Azim Premji University, Menon Sab mentioned, but also Tata Institute and a whole range of other organizations which are training young cadre to do that. And they're very interesting and committed work. And the work that the Sphere India and other networks, many of them, are doing at a national level, local level, or the NGOs, for example, such as SEEDS or SSP, Swayam Shikshan Prayog is doing, donors such as DFID, EU, and others, and the UN agencies' work. And quickly to my mind comes the work that UNICEF and UNEP is doing, and we'll make reference to that why it's important to do that. So having recognized what is done on the 10 points that the Prime Minister has listed for us to focus on, and what are the new opportunities within that to move ahead. And of course, I'll draw mostly from my own work in terms of All India Disaster Mitigation's work, because that's something concrete and I feel comfortable having opinion about than perhaps the work that much better work, but somebody else has done, because they should talk about their own work. So the first and most important thing that I want to underline as where there is an opportunity to move ahead, but there is a setback, and there is a setback to all the 10 programs points due to the pandemic. And I think we need to recognize that it has not only slowed down, but it has given a setback to the initiatives that have been done under DRR, National Disaster Management Plan, as well as the Prime Minister's 10 points. So there is an existential crisis that DRR institutions are facing, that DRR authorities are facing, state, national, others. There's an existential crisis that various initiatives, civil society, networks, groups, all are facing. And to an extent, Dr. Santosh Kumar mentioned that, pointed out to that, the whole existential crisis, which I'm putting into the label of existential crisis. So that's the setback. But opportunity there that I see is happening, and which is where we have started working on, is the opportunity to reimagine the sector. And the sector as it is, obviously is very useful and has helped us move where we are. But there is a need to reimagine the sector, but also reimagine the context within which we are working. And context has very rapidly changed, not only in last 3 years, but in last 1 year, in fact, 9 months as well. So that is something, very quickly we need to grasp, otherwise we'll be left behind. And also reimagine the future that we saw. So, when we had, making every Indian safe from disaster risk was the future that we had. And maybe we need to revisit that and look at, for example, in our work, not only every Indian, but every Indian and his neighbor needs to be safe, because we can't really separate out. Or every Indian and every person he's in contact with, we need to make safe. So I think that's the whole reimagining the sector, context, future. And I think this is something that NIDM would be able to so well suited to do that, because that's what its role is in any case under the National Disaster Management Act. But also that is what it has been doing and leading us by example. So that's one area I think would be very useful to work on as far as the disaster risk mitigation and communities are concerned. And you can't have mitigation if we have not reimagined what we are doing. So that's the first point I would like to make. The second important opportunity that we see, and we are working on actually, is that there is a big gap between the initiatives, public, private, civil society, government, and the operations. So we have good initiatives and we have good operation, but there's a big gap. And that gap needs to be recognized. There is a gap between ideas and implementation, and that needs to be recognized. And there are plans and processes that we actually use to unfold the plan. And Dr. Menon quite clearly, for example, underlined the plan for lockdown and the process through which lockdown took place. So there was a gap, as we saw all over. So that is something which is keeping the 10 points behind. And the opportunity there where we are working, and I think many others must be working, we can all work together, is the opportunity to plan the measures, tools, of course, technology, and some of them Dr. Menon mentioned about artificial intelligence, robotics, and but also some of the simpler technologies, geospatial, which we've been using for more than a decade, and monitoring to bridge the gap. And that is something National Disaster Management Authority is so very well suited to see that, there will be a gap always, but how do you monitor the gap so that gap doesn't become so big that we really don't know where the army is fighting and where the war is. So I think that gap needs to be made manageable. And that's something we see a big opportunity to do that. We are working on that. And I think there are ways of doing it. As I said, certain tools will be useful, certain technology would be useful, certain measures which are needed, which would be useful. So that's a second opportunity. The third opportunity I would like to mention, and here I'm also addressing a question that Anusha Fatima has raised from the Cyclone Fani and financing that is needed for disaster risk and mitigation and community sustainability. And the gap is that what has happened is that DRR has become a thing of its own, and has moved away from or has less and less influence about what is happening in urban sector. If we take the pandemic in the health sector, the leadership of DRR vis-a-vis the health sector's own leadership, there is a gap that we see that. If you take urban transportation, for example, and DRR, and again, the transportation is unfolding. So how do you make not only mainstream, which of course is important and is being done and can be done more, but how do you address and put DRR at the intersectionality, you know, where all these sectors cut together simultaneously, and what are those points where DRR can be put in the center so that the intersectionality of various sectoral initiatives, opportunities could be better availed of. So there is an opportunity, as we see in the ongoing work, to accelerate and augment with focus on local governments where this intersectionality is very clear. So when you go to at a district level, district authority, or when you go to the city authority, that intersectionality is so clear, because there you can't separate that this is, you know, this sector or that sector, because everything is together, local you go. And there we see that perhaps All India local self-government may want to be far more active, you know, in training, as Dr. Gagan Sinha mentioned, but also there are other ways to be far more active. Some pilots you may want to take up, you may want to do more lessons learned that has happened there. Policy shaping, not at a national level, which we have, but at each city needs different policy approach. So, I mean, how do you help cities make that DRR policy, which addresses intersectionality? And some very good work is done by UNDRR, and we can draw from that, but we'll have to change a lot, because we worked on that and we found that it's applicable, but it needs a fair amount of work to make it applicable. So that's the other opportunity that we see from our work in terms of disaster risk mitigation and community sustainability. There is also, for example, something which is really missing, and I think in a way, Dr. Vinod Menon was lamenting about the migrants, and you know what we saw that, and of course we all feel very, very strongly about it, that how can this happen? And what has happened is that we don't have a universal, not uniform, but universal social protection as part of mitigation measures, and funding and operations is yet to realize. We don't have the mitigation fund, and therefore we don't have mitigation funding, and therefore we don't have the funding and operations that could be used to have a universal but not uniform social protection. So there is an opportunity to actually take disasters such as cyclones, disasters such as pandemic, to actually shape the mitigation fund and the funding that comes from that, which can augment the social protection for poor and vulnerable disaster victims, but also at-risk communities. And EMDA, I think, would be very well suited here to look at what role it can play to bring various experiences from various countries, such as Netherlands, for example, such as Sweden, for example. Of course, some of the non-European countries as well we should look at. But that's a big, big missing piece, that there is no social protection, which includes relief, rehabilitation, recovery measures, which is universal, available to everybody. There are many, many issues that are addressed by various programs and schemes, but there is no universal social protection that is offered to various, to the population. So that's an opportunity that we have. Another opportunity that we found, and we are working on that, and I'd like to share that if there is interest among the participants as well as panel to look at, is to look at urban agriculture, for example, urban forestry, for example, urban horticulture, for example. Ecosystem-based risk reducers are not yet explored in towns and cities. So in fact, we allow our towns and cities to clean and kill in many cases, if I can use the strong word, to the existing ecosystem. And then we want ecosystem-based approaches to do that. So how do we do city planning differently, city development differently, so that our urban agriculture, urban forestry, urban horticulture is very much part of the urban development, local governance, and therefore we don't need a separate initiative, money, time, training, etc., to make the local government make use of ecosystem-based initiatives. So there is a big opportunity that all India local self-government may want to take, to have some pilots in some of the local self-government authorities, and you may find funds from National Disaster Management Authority, maybe donors such as EU, or maybe EMDA wants to participate there. But to have green urban communities across geo-agro climatic zones of India. And that would be a good start, because that's something we had planned to do, and I was hoping after Paris that will happen, Paris Agreement. And for whatever reasons, it has not really taken off. But it was also quite initiated by Dr. Menon when you were in the National Disaster Management Authority. And I have some notes from 2 different events that had addressed this. And for whatever reason, I mean, we are also busy, so it has been left behind. But we see a big opportunity. And our AIDMI's initial assessment shows that that's something which is really, really very important and will show us a way ahead to do that. Talking about money, again, what we found, and Dr. Menon mentioned about various allotments that are being made. And also, personally, I know you are very keen, so am I think all of us, about the voluntary action that is taking place as far as disaster risk is concerned, mitigation is concerned. But that voluntary action is not recognized and supported as much as it should be. So we have various laws, regulations to control, to guide, to make them accountable, transparent, the voluntary actions, civil society actions. And of course, they are needed, and we should all be open to that. But besides control, we also need to grow them. And if we don't grow the voluntary actions, voluntary initiatives, civil society initiatives, we won't have partners to work with, because that's very much part of the society. So while they know control and regulation and all that is going on, there has to be, we think, a major opportunity for donors and authorities to scope out investment plan, that what kind of financial investment we will make at local self-government level, so that, for example, municipality of Cochin or municipality of a small town in Assam is able to give money to local authority which is based in that city, in that district, and say, look, we can't do this, can we do this together, and here is the money. And that investment in voluntary sector, civil society sector, that is something has not been happening as far as DRR is concerned. At a scale, it should happen. At a spread, that it should happen. I may be wrong, but I don't think I'm wrong. I'm open to any correction on that. But that would be a very important plan that organizations such as Sphere, organizations such as many other very good, they could actually argue for, and this could be taken up. So that's about the voluntary and the civil sector, civil society sector that we have. The other thing is about, and we've always seen cities as a place to live and industry, but the original idea of a city was a market, that where people from various rural villages came and exchanged, and that's how Mohenjo-daro and that's how Harappa and all those things came up, and it has continued for centuries and millennia together. And we need to go back to that concept of cities as a market and see that in the small towns and cities, what is the market for the artisans, the craftspeople, the agriculture producers, that they can bring, so that when there is a disaster, they don't have to interrupt their supply and demand, because there is a local market which is already supplying and demanding this local products as well. The reason we saw such a large migrant population moving from here to there, because they don't have things that they produce to be sold in local markets. So what we are doing is actually wiping out the existing local markets and overlapping that with markets which needs a lot of long distance travel and connections of people and goods and services. And that, of course, has carbon footprint, water footprint, but it also separates the people from their families, young people from their families. So to address that, as part of mitigation, we see the opportunity to set up a resilient national network of artisan markets. That why can't we have, for example, in Delhi, you have Delhi Heart, and everybody enjoys going there, and that's one. But why can't we have many of them within the city of Delhi? But in every city, there is a Delhi Heart and Mumbai Heart and Ahmedabad Heart and Morasa and Mehsana, so that the local artisan, craftspeople, local agriculture producer, horticulturists, local forestry people can bring their produce, which then we can use directly. It would reduce the cost. It would be cheaper, number one. And second, it will be far more authentic and fresh to do that. And that is something, again, maybe All India Local Self-Government and NIDM can jointly do together. And that's a large area where there is work to be done. I'm coming to the end of my presentation. And Dikshit Saab, I would also like to make look at two parts.
Sorry to interrupt, sir. I will come to you again in the second round. So with some questions from the audience and some of my questions based of your presentation. So I will come to you again. Now I would like to go to. Thank you so much, sir. Thank you so much, sir.
Thank you,
Abhishek. In the meanwhile, can you ask Mihir Bhai to just give a concluding point where he was interrupted in between?
Yeah, please. Please go ahead, sir.
Yeah, so actually I'll take up. So I think another area is opportunity is for upscaling and wide scaling various green initiatives which are already there in local self-governments. For example, Kerala, after the floods, they have these e-auto rickshaws. And how do you upscale that to every city, every town, where there is a demand, and which I can explain later on. And the other aspect, which is that with Dr. Santosh Kumar mentioned, the cascading events, and that's happening more and more. So how do we develop what is called a mitigation justice, so that various local authorities have, resource share, the share of their expertise, which is just, and not that certain cities keep on receiving more and more input money, time, effort, expertise, and others don't. So as a way ahead, I'd like to conclude, Dr. Santosh Kumar, that if EMDA and NIDM and All India Local Self-Government would, of course, Vinod Saab and Dikshit Saab, you also, make a sort of 3 to 5 year plan, kind of a roadmap, if you will, that how do you take these ideas further and actually implement them through trainings, for example, through pilots, for example, through lessons learned and knowledge co-creation, for example, and reviews of existing initiatives that are taken. That may be something useful to come out of today's discussion as a way ahead. And I think the good part is that you more or less have the partners to start with. Of course, you should add many more into this so that you could move ahead. So thank you very much. Sorry, I've taken a bit longer than perhaps you anticipated. And Virupaksha Dikshit Saab, sorry, I've taken your time. Thank you so much.
Thank you so much, sir. And you have mentioned two very important points of bringing more partners for this mission, and also about reimagining how we are dealing with disaster mitigation. And the very important point that you mentioned, I would like to highlight that this urban forestry and how we can improve our whole ecosystem that can deal with disasters. Thank you so much, sir, for your
Practical Action has done a lot of work on urban green cities, sort of. Yeah, thank you.
Now I would like to go to Mr. Dr. Virupaksha Dikshit. He is India Coordinator for Practical Action. Dr. Dikshit is currently working as India Coordinator for Practical Action and is responsible for managing programs on urban wash, renewable energy, climate change, and market access. He has a strong of basic education, mother and child health, nutrition, water and sanitation, renewable energy and livelihoods, including cross-cutting issues such as HIV, gender, environment, market, child participation protection, and disaster risk reduction. Now I would invite Dr. Dikshit for his presentation. Dr. Dikshit, over to you.
Thank you, Abhishek. Respected dignitaries, thanks for inviting me to such a nice discussion. It was definitely a learning platform for many as well as for me. Actually, I am learning from the great minds those are sitting with me, and I am really privileged to be a part of these people particularly. If we talk about this disaster and its mitigation and sustainable communities, I would say, you will see this India's population as per 2011 census, the urban population is around 377 million, which is around 34% of the total population. And in that decade particularly, if we'll see, around 91 million people added to the urban population. So the fact is that this urban population is growing and it is growing largely in almost all over the world, you can say. Even in India, the situation is not different. And if we'll see, Odisha has, in disaster, Odisha has created many examples that those who practice in disaster sectors that were very well aware about that. The disasters, those actually, my state usually faces, those are flood, flash flood, cyclone, earthquake, heat wave, drought, and besides that, lightning, snake bites, and fire accidents also happen. But you will see the Indian context, 29 cities are prone to severe earthquake, 53 cities are prone to severe cyclone, and most of the cities we can say struggling with waterlogging and this urban flooding we can say. And this situation is actually it's not life-threatening. It is also damaging livelihoods. It is creating lots of challenges for the people as well as the administrators. Then what makes cities particularly vulnerable to disaster? If we'll see, disasters are natural and man-made, we all know. But urban disasters are mostly man-made, like the waterlogging, urban flooding, the water scarcity, the industrial issues. These are particularly man-made, and this can be managed particularly. But unfortunately, we have not been that able. We have not been that great in responding to the mitigation aspect particularly. And the urban cities, why they struggle because the rapid growth and inadequate and improper planning, we can say. And if you see the urban locality, the population density is very high. And as Mir Bhai also said, the ecological imbalance, that is also creating lots of challenges. And in urban areas, we have lots of over-dependency on the infrastructure and services. And if you see the resources are politically motivated ones, those are concentrated to some areas. And unfortunately, in almost all the Indian urban cities, we see inappropriate constructions. And these are actually creating lots of challenges, and that's why the urban life is becoming more vulnerable, more miserable, and people are struggling with that. And if you'll see the population density is so high, and this pandemic we are discussing, COVID-19 is affecting lots of people, and in urban location, the situation is very poor because of that reason particularly. In the urban population, who are the most vulnerable people? Population to where the population density is very high, they are mostly vulnerable. And even if you see the informal settlement in all over the urban localities, they are vulnerable because they rarely own their houses and they struggle with ownership issues. And many settlement areas, actually, if you see, they are actually located in environmentally vulnerable areas, and those areas are actually lowlands where actually waterlogged mostly, and they struggle mostly because of that reason. And the government services that we see, those are actually not adequate in most of the cases. Then how can we make the cities how can we make the cities safer particularly? And like if we'll encourage the development policies that reduce vulnerabilities, where actually it talks about land use, risk assessment, disaster risk impact assessment, design, construct and maintenance of infrastructures, and integration of services, then actually I think we can be able to do that. Then we have to prepare the city managers to cope with emergency situations. Like in most of the cities, the municipal bodies, the urban local bodies they are not aware of these issues particularly. Even if they are aware, they don't know how to deal with such issues. And that's why actually I think we need to prepare city managers to cope with emergency situations. Like emergency management planning should be a part of this. Then the institution needs to be strengthened, and the communication and awareness should be done. Then the other component is the community part. The community needs to be educated and prepared to address the issues. And for that, we need to do public awareness and education, and community-based programs and solutions are required. And the community groups, those are needs to be involved in planning, which is actually missing in Indian context very, very much. And besides that, I think we should think of the special programs for high-risk situations, where actually for the informal settlements, for that actually we need to have special programs. Then there should be essential facilities. There are high-risk groups for whom we should consider something. And there are cultural treasures that we need to see, and building with hazardous substances that needs to be have some special plans. People see like what actually we have missed mostly, like is there any solution or not? I was going through some literature and I found like if you see the countries like Philippines, where actually 5% of their municipality fund goes for calamity relief fund, and 70% of that particular fund they use for preparedness, procurement of relief and rescue equipments. And we don't have that practices very much. So it can actually make the people prepared to face the adverse climatic conditions. And if we take the example of Malaysia, like Malaysia has constructed numbers of storm water drainage road tunnels, and that actually what that allows large volume of flood water to divert to storage reservoirs. And in India, most of the cities are struggling, and this 2-3 hours of rains, and the city has a big flood, and lots of properties are losing. Even some cities, deaths are actually, casualties are happening also. And in Japan, if you'll see, like in the schools, a regular earthquake drills are happening. So that create education, awareness, and preparedness. And that from the very beginning, it's from the childhood a person can learn how to manage the situations. So those are the areas actually which are missing mostly in Indian context. Like somebody asked whether there is financing mechanism. Financing mechanism is there. People used, the government used to spend money. But personally, I feel disaster has become a political issue. It has become a political work. Like the government prefer more for this rescue, most for the evacuation, mostly they spend money on relief materials. The resilient building component is mostly missing in the government plans, and that we need to address in any way. Then I think in the urban localities, as the population is growing, the city geography is not growing. So what is happening? Like the green areas, the agriculture patches are converting into homestead land. And at the end, those actually, because of those unplanned constructions and unplanned expansion, cities is submerging in water. So I think the government should take some action, like maybe they can think of 70% of the land can be used for building and other services, and 30% can be kept for the agriculture purpose. I am not saying the 70-30 is a proper ratio, but at least we can think of this and we can do that much. Then somewhere actually jokingly I used to say, if you see the condition of Delhi today, I think Delhi's growth is mostly because it's a capital city. And even the states, if you see the capital cities are mostly struggling. And can we think of it may look funny, it may sound funny to many, but can we think of keeping a city as a capital of the state for a few years? Then can we think of changing it? So as the population pressure on that particular city, the industrial pressure on that particular city, the administrative pressure on that particular city can change, and all the cities can get the scope to grow, and all the cities can have a very normal kind of life. So these are the like my points, and I conclude with this. I thank you to the organizer for inviting me for this discussion. Thank you very much.
Thank you, Mr. Dikshit, for your presentation and suggesting some solutions for making our cities resilient to disasters, and also suggesting very unique suggestion that we can shift our capital cities to the different state capitals for time being, and we can see how it turns out. Thank you so much. Now we have some question from the audience. I think the question of Anusha Fatima has already been answered. One part has already been answered, but the first part, it still remains. That is, she's asking that we all know that severity and impact of Cyclone Fani in regions of Odisha and West Bengal. Do we have any strategy to minimize the impact of cyclone on power infrastructure? Very specific question. Any policy designed? I would ask Professor Santosh, because from my little understanding, I would request Professor Santosh to address this.
It's a very good question, that how the sectoral loss could be minimized, especially when it comes to various disasters, and in the case of Fani. It's a very interesting, when we were there, our whole team, Dr. Anuradha is also there, when we visited Fani areas, affected areas, and we found that large damage happened to the power sector. And the state of Odisha was into deep darkness. And we were discussing with the power sector people, and they were talking about the failure of transmission and distribution. The generation was taken care of. So the power generation was taken care of, so transmission and distribution. So that management was done during that time with the help of generator, and that too we brought in from the Andhra Pradesh. So that was that extraordinary cost happening to that, and maintenance and everything. And when the detail out which we were doing, they were looking at the new design of the entire pole, electric poles, and setting up in the recovery plan. And in the center also, they also talk to the distribution is the local state government they get engaged into, but the transmission is the central government. So that even the power we are getting is the center state mix. The transmission and generation somewhere is happening, transmission is happening here, and then we are getting as a kind of a distributed line. So both the institutions, like both the department, the state government and the national government got together, and we're discussing about that, how that the synergy could be brought in terms of inputting for the resilient infrastructure. And the entire the recovery plan has been that is addressing this issue, and they are making a kind of a resilient as a threshold test they have done, that how much the super cyclone Odisha has been taken as a kind of a the threshold limit that probably Odisha is capable of. So that kind of a designing in power sector is there. But now what the question she is asking, that how it will go pan-India. Like in one state, they have been facing this kind of a disasters, but whether it's coming into the central government plan and also at the various other state government plan, that how we are going to make as a resilient infrastructure. So many states, those who are taking recovery, they are addressing it, but there where it is not, we have a very limited program. But Kerala have started that also as a kind of a very resilient one. Now Kerala, Dr. Vinod Menon will also focus on that. But there also, then when we did the post-disaster need assessment, we found that the recommendations of the government, and government accepted it also, and they are looking into bringing a resilient infrastructure, not only in power sector but other sectors as well. So what I'm saying is that the current initiative of the government also, the 15th Finance Commission has also said that recovery fund is already there now in the 15th Finance Commission recommendation. But if you have to do this, build back better is the kind of a prima facie. Like if you have to be, any project is to be looked into. And if that PDNA is not done and the resilience, build back better, when building resilient feature is not there, then probably you won't be able to, will not be entitled for this fund. So that kind of put pressure and pull factor and the push factor will go. But I would suggest that all states should, those who are getting affected on a regular basis, they should start seriously into that building resilience or making such kind of a resilience into the entire outfit of the plan itself.
Thank you so much, sir. I think we have lost connection with Professor Menon. Ashley, please check this. And meanwhile, I would like to go to, there is another question from Sachidanand Pandey and Hitesh. That is, in Bihar, particularly North Bihar, flood is major cause of greater disaster to families and villages. For 6 months, almost no farming. How to deal with rivers coming from Nepal, dams opened. And the similar question has been asked by Hitesh. He is asking that floods cause a lot of destruction and loss of human lives every year, but then also coastal cities are worst hit every time. What are the possible solutions to this, and why are authorities not taking it seriously? I would direct this question to Mr. Mihir Bhatt to answer this question.
Sure. Sachidanand Bhai and Hitesh, both of you, yeah, thank you. Bihar is doing a lot in terms of floods, and somehow it ends up, needing to do more because of the transboundary flood risk that it faces. And I think the direction for us to move is to have a transboundary early warning system on floods to start with. And in fact, we've done some work on transboundary early warning system, both as AIILSG in terms of India, Nepal, but as a network of like-minded people, Duryog Nivaran, on South Asia Disaster Report 2019, and where practical action has been a supporter of that, to see how transboundary early warning system can perform better so that the floods in Bihar specifically are, one, not so devastating, and second, not so frequent, in a sense that the scope of damage and loss is not as much. I'll be very happy to share some of the findings of the South Asia Disaster Report 2019, which is being finalized very soon. But one thing I would like to underline for Mr. Pandey and Hitesh Bhai, that our early warning system needs an alternative perspective. And as Schumacher talked about, small is beautiful. The early warning needs something which is very succinct and powerful. And looking at the work that Practical Action has done, World Vision has done, many other international organizations have done on transboundary India, Nepal, India, Bangladesh. What is, how early is early? And that is something we've not quite focused our attention to. So I think the answer to these regular floods lies on how early is early. And second, the more decentralized these early warning systems are, they are more likely to be effective than a central early warning system, however technologically, big achievement it may be, but sociologically, it's going to not perform so well. Thank you.
Thank you, sir.
Can I add something here? If you
have... Sure, sir. Sure, sir.
What Mihir Bhai has said is very correct. And when I was the director of the SARC Disaster Management Center, and during that time, we initiative also made regarding this tripartite kind of agreement between the government of India, state of Bihar, and also the government of Nepal. On the base, like on the Mekong River concept, which they have in the other region. So that kind of a concept which government of India is also working out, and they have this agreement with government of Nepal also. So at times this is a kind of a bilateral issues, and they are also discussing on many things that ecosystem based approach, what Professor Menon has said. And Mr. Mihir Bhai is also saying that why not we bring the ecosystem approach. So early warning is one that is very much appreciated all along, that the community level early warning system, but larger kind of a broader arrangement of construction of whether any infrastructure is required at the highest level, because the rains are happening there and Bihar is getting flooded. So what kind of this water flow systems could be regulated? So that is another approach which is the government of India and government of Nepal is working on. Maybe the role of regional institution could also be very, very important, and partnership, when we are saying roping into the this regional intergovernmental bodies, or what EMDA is doing and all such kind of a pressure group could also work as a kind for regional cooperation in the similarly like Bangladesh and India, which we have, or in the upper regions, China and India. So Brahmaputra region and also this region. So these are the things which are as a part of recommendation to strengthen the regional cooperation and also that strengthening of the regional institutions as well.
Thank you so much, sir. Thank you for your intervention in this. I would like to, because we have Professor Menon has joined us. So we have answered this question on financing at city level, but I would like Professor Menon's point of view on this enhancing resilience of a city that Anusha has asked about. What are the financing instruments are available to enhance resilience of a city? So his point of view on increasing resilience of city.
I think, we have different types of solutions available. One is at the local level, the kind of insurance facilities which are there as a risk transfer instrument. We have actually seen a lot of innovations happening, both from the government side as well as from the civil society organizations. Mihir Bhatt's, All India Disaster Mitigation Institute in Ahmedabad had actually initiated some, insurance facility for, people who would actually need to protect their assets. So insurance is, our insurance penetration is very low in the cities. Vehicles are insured, but at the same time, buildings are not insured. Even government buildings are not insured. So there is a need to really look at the multi-hazard resilience of, assets. And need to come up with innovative risk transfer instruments. So I'm sure that with the opening up of the economy to facilitate even reinsurance companies like Munich Re and Swiss Re and various others to come in. Otherwise, we only have the GIC insurance, which is providing the insurance cover and reinsurance cover. So we need to have a competition which will actually also provide opportunity for institutions to compete, and even with the state governments to get into bilateral and multilateral collaboration arrangements would also be welcome. Like you have the Caribbean risk transfer facility, which was created by the World Bank. You have experience from Mexico, you have experience from Turkey, from Istanbul and many other regions. So we have actually many experiences. So I think we need to look at what are the good practices and see how can we really partner with municipal bodies, urban municipal agencies. Now we are also seeing this, Lucknow Municipal Corporation going in for a bond. There are 11 municipal corporations which have actually raised municipal bonds, from the stock exchange. So these are innovative ideas, and I think we need to really look at possible solutions and also possible stakeholder partnerships. And I'm sure with EMDA and with All Indian Institute of Local Self-Government and with NIDM and with other partners within the financial institutions, along with IRDA, a lot of discussions can actually happen, and then we can come up with innovative, good practice solutions, which are actually taken up by good allies within the municipal corporations in the country. Thank you.
Thank you so much, sir. Before I go for the concluding remarks from each speaker, there are some questions. I will club them together for Dr. Dixit. The questions are regarding how our urban local bodies are responding to disasters and how this ecosystem approach in disaster management is helping actually. And there is one more question about the climate change affecting the frequency of disaster in India because of this climate change happening. So Dr. Dikshit.
See, as I said, like in most of the municipalities, the municipal officials are not very much aware about the mitigation component. The mitigation aspect is missing, as like Mir Bhai also said, like we don't think about mitigation, mostly think about rescue, think about relief. And if we can build the capacity of the municipal authority involving the community and how we can build their capacity, those things can be done, then I think the municipality can properly manage the disasters. And coming to the ecosystem approach, it will see this ecosystem approach provides multiple benefits. Multiple benefits means like it provides livelihood, like people, the human well-being depends upon it, and ecosystem provides the livelihood to the people. And so the judicious, hello?
Yes, sir.
Not audible?
Yeah, you are audible.
The judicious use, the judicious use of land, water, and the living things are highly required in ecosystem approach. And ecosystem approach also, like you can manage properly the like the wetlands, the forest, and the coastal system. Those actually provide buffer zones for natural events that can be managed properly. That can be like we are wasting those, we are overutilizing those, and those can be managed properly. That can help us. Then ecosystem degradation can be controlled, and if we can do that, we can definitely avoid lots of disasters, because it will like help the natural ecosystem to prosper, and it can help the human being ultimately by the reduction of the number of disasters.
Thank you, Dikshit. Now there is one more question, last question I would pose to Mr. Gagan Sinha. So because Mr. Pete has asked about EMDA, Netherlands and Luxembourg, do local institutions in disaster-prone areas have operational guidelines for how to act after disasters? In the Philippines, this functions very well. So this is the question from Pete. Mr. Sinha.
No, so can you repeat that? The question is that the post-disaster response you said.
Do local institutions in disaster-prone areas have operational guidelines for how to act after disaster?
Yes, in India, of course, they do in India, and I think the experts on the panel will be very, very clear as to those guidelines, because it is of course it is primarily NDMA which comes in with the immediate relief, and before even the civil society, there's of course the immediate relief, and then the sustained rehabilitation that comes in. So of course the government does take the initiative, and every disaster is difficult to say that what is the format for each. A pandemic may be different from a flood to a forest fire, So yes, there are systems, and they're not a set format, but yes, that who operates immediately the state government of course steps in. Yet, correct me if I'm wrong, Professor Menon. And that's the immediate relief, and then there are of course the options to plan your rehabilitation process, and that individual organizations can take up subject to approval of the government there. Yeah.
Thank you, Mr. Sinha.
I would like to just add, saying that the earlier calamity relief fund directives have changed now. The Finance Commission is actually making allocations to the states for the National Disaster Response Fund at the national level and the State Disaster Response Fund at the state level. So the state governments actually provide the initial relief based on the nature of the devastation which has actually happened. They provide the relief to the affected people. But however, I think as far as the question about the instruments for support, the states have prepared the state disaster management plan, and the districts have prepared the district disaster management plan. And many states have actually taken the help of professionals to prepare these district disaster management plans also. And then you have many states have gone in for preparing village disaster management plans at the village level or at the Gram Panchayat level, where they can actually understand what is the kind of preparedness and response measures and risk reduction measures which can be undertaken. So, but this is still evolving. and very often, like the Secretary General of the UN, former Secretary General of the UN, Mr. Kofi Annan had said, relief is actually a photo opportunity, and risk reduction is actually investments in disasters that don't happen.
Yeah.
So it's not really fancy, However, we need to institutionalize that, and that is where we need to work together with partnerships to make sure that risk reduction becomes a priority agenda, especially because of extreme events, climate change, and also disasters like COVID-19, which are happening. And there is also a very famous Lancet editorial which has come recently, which said COVID-19 is not a pandemic. And the editorial said COVID-19 is a syndemic. What is a syndemic? It was defined as sequential and concurrently evolving epidemics. A series of outbreaks are happening, and that is a syndemic. So if you really look at what is happening now, you can also see that even in Europe, there have been some outbreaks happening, which are also of, the avian influenza and others are coming back in different formats. So I think, we need to be prepared that, our levels of preparedness has to be also in strengthening our capacities to understand early warning signals, prepare ourselves, and work with partnerships to take it forward. Thank you.
Thank you so much, sir. I would go to speaker for their concluding remarks and telling us how to go further in this in the direction of disaster risk reduction. I will go we will go in the same order, but I will keep Professor Santosh at last. So he will give us overview what is his idea, how we are going forward with this vision. I will start with Mihir Bhatt, sir, for your concluding remarks on this webinar, on this discussion. Mr. Mihir Bhatt.
Yeah, I think I did mention sort of possible way ahead, and I guess that would be my concluding remark, in a sense that you've taken this initiative, and please the partners who've taken this continue this and make sure we move ahead in a systematic and system-wide manner as we do. And I also had a small information, not concluding, but sort of information for the question around power sector. And I think that's another area I didn't mention, but that's an area where far more work needs to be done, especially since the sector was addressed in Kerala quite differently and vibrantly. And what we found, what is needed in power sector and DRR is beyond this sort of, putting up the lampposts again and power transmission lines again, there is needed a system-wide energy innovation, because power sector is changing very rapidly. It's not going to be the same as we know in next 5 years, the way India is changing its power sector. There will be also aspect of energy conservation, including use, reuse in urban and rural areas, regional and industrial use of energy. And that's power sector. So not only the lines, the supply, but the use of that is also going to change, and that DRR has not looked at carefully. The third thing we found is that reaching out to energy frontiers in terms of technology, society, economy, and environment. Because technology on power is changing so rapidly that our making preparedness plan to put that transmission power again is going to be defunct. It's like telecommunication. Everybody has a mobile, and landline have become almost history. So I think keeping that in mind, the frontiers of power sector, the DRR policies needs to be evolved, and that's a big area I would like to add to the list of things that I added as way ahead, possible way ahead. Thank you. Fatima, thanks for asking that question.
Thank you so much, sir. Now I would request Dr. Dikshit to give his remarks.
Thank you. Like as I said during my presentation also, like we need to take the urban disaster seriously. That I feel like being a citizen of this country, sometimes I feel the municipalities, the countries not taking few issues very seriously. And they need to plan and execute the policies and plans properly. The execution part is mostly missing in many things, and due to a faulty execution of many things, actually the disasters are also some kind of disasters happening. Like the water logging in Bhubaneswar is a faulty construction of road. They are increasing the height of road each year, and now all the houses in Bhubaneswar have gone down to the road level. So the water is entering the house on a very small rain also. So that is, I am just giving a small example. Like moving beyond relief and reconstruction is the need of the hour. Like as we said, like relief and reconstructions are very romantic. It looks good, and people love to take photos. But risk reduction and mitigations are major components, and we need to move beyond the politics of development to the real development picture. If we are not doing all those things, and like for the NGOs and NGOs, those are working in this particular sector, they need to partner more, they need to showcase examples, and they need to put pressure on the government, like how to replicate the models in other places, other countries. Like we discussed about flood early warning system that has been demonstrated in many places successfully, but that has not been a plan of the government as of now. I gave few examples of very innovative works by Philippines, Malaysia, and Japan, but those are the good learnings which can be replicated. We need to keep ourselves open to learn from others and implement that in our respective areas. Thank you.
Thank you, Dr. Dikshit. Now I'll ask Mr. Sinha to intervene in this and tell us how our local bodies and the role of disaster risk mitigation at local level is required, and how we can go about it. Mr. Sinha.
So on my take after today's the discussion is, I have two major points. I believe prevention is always better than cure. So it's a good planning of whether cities, towns, villages is critical, creating awareness and letting the people know that how best to be, and making them aware and for any consequence that can come. So therefore I would say planning is better, and a better planning in different levels. And secondly is what Mihir Bhai mentioned, in case something is to happen, unfortunately, then we need to have a system whereby the gap between the planning and implementation should be minimized. So these are the two critical points is what I would suggest for mitigation for disaster. Yeah, thank you.
Thank you, Mr. Sinha. Now, I would like to go to Mr. Menon. Sir, I would request you to give us your idea of engaging all stakeholders together, bringing all stakeholders together for implementing the 10-point agenda of Prime Minister and Sendai framework and SDGs. How we can go about this?
No, that's a very good question. In fact, actually, I feel that we are actually having an infodemic of webinars. Lots of webinars are happening, but at the same time, we are not really seeing credible outcomes and follow-ups. So my suggestion is first to have maybe a very focused one-day event with 4 sessions, on this topic of multi-stakeholder engagement, which All India Institute of Local Self-Government can initiate, and bring in a roundtable. Call it a roundtable of professionals, from the corporate sector, from the civil society organizations, from governments, from urban local bodies, because there are some outstanding work which has been done as good practice initiatives by, commissioners in some urban urban authorities. So identify those kind of, solutions which have happened, large response efforts. And 5 major corporate sector corpus funds have been created to provide COVID relief, response, 100 crore funds. So I think we need to understand that there is a lot of goodwill, but we need to know where is the demand and what is the supply. We need to bring in this demand and supply together. And so I would suggest interact with civil society organizations, with academics, with practitioners, with urban planners, with epidemiologists, and then try and see what are the good practices. Maybe even follow it up with a study on what are these good practices so that we learn from this. If you recall, we only had one lab when the first case actually happened on the 30th of January. Okay, we only had one lab for testing. And when the lockdown was announced, we had 72 labs on the 25th of March. Now we have 2,000 labs, but it is after 10 months. So what is the level of preparedness to do that? And now we have plenty of PPE kits. We have N95 masks which are getting produced with, with the cooperation of a corporate sector, which has been funded. And so I think, we need to really look at this as an opportunity, do a lessons learned study as a follow-up of this roundtable. And I think that will be a major contribution. Thank you.
Thank you so much, sir, for your input and telling us how we can prepare for future disasters if there are any. So now, last but not the least, I would like to go to Professor Santosh Kumar, who is leading this whole initiative very energetically and enthusiastically. Sir, I would request you to please lay a roadmap for us to go ahead from after this webinar. What is your idea and how you want to suggest we can go ahead?
Thank you so much, Abhishek. What all the distinguished speakers have mentioned, they all said that what and also how we can take up. And many more seminars and webinars are being conducted by National Institute of Urban Affairs and also the Ministry of Urban Affairs. So what I would suggest, maybe taking the stock, what kind of recommendations have been given by them. And what Professor Menon has said, that we have to have a focused one. We can also go a sector-wise approach. Like suppose today we say that how power sector is it? Let us have a seminar on power sector. Then you have a seminar on say other infrastructure, critical infrastructure sector. Then so all the partners and stakeholders can come together. And the last culminating as a round table, what Professor Menon has suggested, that all sector approach, they all will come with their own framework, and these are the point of discussion that they've had discussed, and these are the outcomes. So that is one way of taking this agenda forward. Maybe an IDM and local self-government and all these partners and the resource persons, we can request them to be the part of the guiding force for us. Professor Menon and Mihir Bhatt and Dr. Dikshit have been working along. The second point which I would like to mention, that what we have realized in the disaster management, probably we have seen disasters definition in a kind of a different way. What Mihir Bhai was saying, that we need to, the context has changed, the things have changed. And COVID-19 has given a new order of kind of a working. We say that whether you call it new normal or you call it a complete abnormal, whatever. So here we say that this kind of a COVID-19 they have actually exposed that in what disaster does. So we say that disaster exposes our inherent weaknesses. And that is inequality, poverty, fragility, vulnerability, social security, kind of system failures, and etc. So these things, which is we say that the underlying drivers for the risk. So how this systematically can be focused in our discussion, instead of discussing disaster definition, what is given in the act. So let us have a paradigm shift in the discussion itself and go by this, that what disaster has exposed us in kind of challenges. The exposure is a challenge. So that's what the challenge. The third thing which I would highlight, that the new system, what Mihir Bhai was telling as a, why not encourage some innovations? How these innovations can be brought in, as he was telling that power sector has an entirely differential need. Globally also, and India also, it is changing very fast. We have a global solar alliance and they have a differential power dependence. We are going with a zero kind of a carbon emission power sector. So recognizing the need of the new climate environment and climate change also, what are those things that people have made innovations, and the recommendations coming from different workshops to compile those recommendations Many of the recommendations we can do to classify into two. One is that what is to be done, and another is how is to be done. So what is to be done, maybe we can find plenty, but how it is to be done, by whom it is to be done, and which level it is to be done. So that probably we need to look at with the local government. And I would suggest that why not have a workshop or webinar with this all the elected representative, mayors, and also the executive together, and see this how most of the how can be presented to them. So these are the things which our proposal is, that in NIDM and all together as a consortium, we can set up a consortium or kind of a think tank for urban risk reduction in the form of with the larger collaborative partners. And we can move ahead at if Professor Menon and Mihir and also Mr. Dikshit see this as a merit, what I'm saying, that probably an IDM would put up a proposal with an executive director and also with the NDM, and not necessarily that we can have that national disaster management plan produced by NDMA. So let's see that how it gets fit into, and not necessarily even if it is not fitting into, we can have that extensive kind of a support from the NDMA and go to the local government. And definitely we have the keep that Ministry of Urban Affairs on the board. And whichever the sector we are talking, that should be the part and parcel. So that's what I would suggest. To start with that next webinar, we can think of what on the lines of what Professor Menon has suggested, and then we can think of taking that forward.
Thank you so much, Professor Santosh Kumar, for your concluding remarks and way forward, how we can plan these webinars constructively, and it will have long impact on other local bodies and also all the stakeholders, those are involved in disaster risk reduction and mitigation. Thank you so much, sir. Now, only one word from speaker, if I take then the one word that Mihir sir mentioned, that reimagining. Now we have to reimagine our thought process and our policy and plans and implementation is strategies, how we can reduce disaster. And like Professor Menon said, that we are in, it is not just epidemic, we are in info pandemic kind of a situation where a lot of webinars and conferences are happening, but the outcome is not visible. So we will try that the outcome of NIDM and AIILSG and EMDA Southasia, the webinars that we are organizing, or the workshop we are organizing, we will work on the basis of outcome basis. We will prepare a report on this webinar also, that will be shared with all the attendees and the speakers also. We will share the link
on the reimagining part only, that we can have set up a small working group, and we can think of putting some of a kind of a research to do that reimagining and drafting a framework.
Sure.
That recommendations we can have in this area.
We will have a list of recommendations. This has been recorded, and everything about all these recommendations that have come, we will not only just make a report out of it, we will also make sure these recommendations are implemented on ground.
So
we will work.
We can think of some demonstrative projects as well.
Sure.
A smaller project we can have and do it at the action research. That could be a part of that where we can demonstrate. So what Mr. Menon is saying, a webmania or web pandemic, we can move ahead from there, and we can go to how this pandemic has given a new normal, new thinking to do that. So this webmania will also give us the good thinking to work on.
Yes. Thanks a lot. And thank you, Dr. Dikshit, for your inputs and how you have suggested also many practical solutions to this whole problem. So we will ensure that in this scheme of things, everything that we have discussed today, we are going to implement, and we are ensuring that all the suggestions those have come are implemented on ground. Thank you very much, Mr. Sinha, Mr. Mihir Bhatt, Professor Menon, Professor Santosh Kumar, and I would also like to thank Ashley, Anuradha, and Mohana for working on this webinar for consistently and very energetically working on this. Thank you so much, and thank you to all the attendees who have attended this webinar on Zoom and also on Facebook. Thank you very much. We will keep you posted with the report of this webinar and our future action plan and the webinars, the events that we are planning. Thank you so much for attending. And till then, you can get all these updates on Urban Update magazine. Also, we will print everything. You can get these updates on Urban Update Facebook page and our web. Thank you so much.
Can I make one suggestion?
Abhishek.
Can I make one suggestion?
Please.
For one of the Urban Update, forthcoming sessions, one of the issues, if you could devote to the COVID-19 experience across states and union territories, and see how some of the urban local bodies have actually, proactively responded. I think that would be useful.
We are working on one issue that will be, we will discuss this separately. I think after this webinar, I will contact you, but we are working on something for collecting all these case studies and success stories of cities and their experiences. And we will publish one specific issue on that. We will share the link with all the speakers so that they can get this Urban Update issue also. Thank you so much once again. Thank you so much. Stay tuned, and we'll be back. We will keep you informed about our future activities. Thank you so much for joining us.
Thank you, Abhishek. To you too.
Thank you so
Thank
much.
you. Thank you. Thank you.
Thank you. Bye.